This is just a little diagram that sort of talks about the continuum, if you will, and where the supported housing policy that we expect to release in the near future. And everyone asks me when that near future date is, and I don't have one for you. But this is about creating that small window of opportunity where maybe someone's needs exceed the community support service visitation, but also may not need the full services, particularly nursing, of a long-term care home, but may need a more intense 24-hour access to personal support. And this is going to be able to allow us to transform supported housing, again, to meet a client need that's greater than currently exists, and to be able to put both the services in the traditional buildings, but also to allow those services to be delivered within a 24-hour period in people's individual homes. The other quality integrated initiative currently underway is through the home care sector. And this is the Integrated Client Care Project that seeks to transform the delivery of home care services at the same time as transforming the case management system navigation role for seniors and other people in the healthcare system. Home care is one of the places that touches an individual and their family through the continuum. As you all know, people can't get into your homes without going through the CCAC, but it's also in terms of discharge from acute care, the ability to do admissions into long-term, into supported housing, adult day programs, chronic and rehab hospital beds, and how do we have a system that provides a navigation, allows the care providers to do the care coordination and not the CCAC case managers, to provide specialized case management to specialized populations, look at coordinated assessments and data and feedback to the professionals on how they're achieving health outcomes, looking at integrated client clinical teams, clinical and leading practices, and then again, the bundled or the alternate payment plans that incent in innovation and pay for health outcomes. So moving away from a fee-for-service model in home care as well. So there are some pilots taking place around the province. Right now there's 4 pilots addressing wound care, and that the launch of the palliative care work will happen later this month. And I think that there's more opportunity at a local level, certainly for long-term care homes, in the continuum of palliative care in the pilot sites. Oh, this is just a little schematic around. We're all in this together. And it's about promoting the innovation and the alignment across the healthcare system. And that we see a future where there's continuing focus and emphasis on the coordination of structures and relationships across organizations and systems, where there's development of integrated information systems. I mean, the beauty of the RIE in and of itself in your organizations, I'm sure you can see. But then the beauty of it is the integration of it from the client's perspective, where they've had the assessment in home care, they may have the assessment in a long-term care home, or they may also be assessed through the community support service, community CHA assessment tool. And we start to be able to both plan care for individuals based on that information, but it also will start to tell us something about seniors' care in the province that we haven't been able to tell that story or understand it ourselves. And so harnessing that kind of data for the future is fairly powerful. And a greater facilitation of client-centered, patient-centered, and including families in our care delivery system, and that we understand how they're experiencing it, and we start to focus our delivery system to meet the needs of individuals. I just want to, in case you missed this, the ISIS chart book for aging in Ontario was released on October 5th. This is work that the ministry has funded and will continue to fund, that at this point tells baseline data around how seniors are experiencing the healthcare system in Ontario. And so this is the information that we will be able to build on over time, both through the quarterly reports, through dashboard reports, and for some key indicators to tell us how we may be impacting and changing the healthcare system and how it's experienced by seniors. And you can certainly go to the ICES website and pull down this report, and I certainly encourage you to do so. And I think the last part is that we have had an emphasis on research and using research for innovation, both in this sector over the last several years. And many of you may be involved in some of the work that's been ongoing from the research chair and knowledge exchange for home care that the ministry funds. Also the Seniors Health Research Transfer Network, SHRTN, and the research collaboration, as many of you are aware of. We also fund ICES for the work that they are doing, and also the Toronto Rehabilitation Institute, who's doing work on disability, aging, and illness. We also have capacity through career scientists, and so we've had the ability to develop research questions and put that out into the field, and knowing that we can have a greater emphasis on research of an aging population, or specifically how services are impacting individuals in an individual sector. We certainly have approximately $10 million out over the next 5 years to support career scientists focusing on seniors and aging research. And this includes some work from Women's College Hospital on using emergency department visits by older adults. Looking at York is doing some work on factors restricting mobility of older adults with chronic disease. We also have work underway at McMaster University in both improving pain management in long-term care and also knowledge transfer in the Alzheimer's disease. And so I think the research agenda will bring us full circle in terms of supporting changes in our practices and our leading practices changing over time, informed by evidence and research. And thank you for having me here today.